Much of the U.S. is now starting to return to some version of normal life, with tens of millions vaccinated, 40% of all adults, and more restrictions being lifted. But halfway around the world, in India, a devastating COVID surge is only getting worse. Yesterday, the country broke its own world record with 412,000 new cases and nearly 4,000 deaths. And models project total case counts and deaths are set to double by June, up to 40 million cases and 400,000 deaths overall. And those are just the confirmed statistics, which experts warn may be significantly undercounted. Meanwhile, just 3% of Indians have been vaccinated so far, 3%. And daily shots have fallen by more than half in recent weeks amid a troubled rollout of vaccines manufactured in the country, which is also stalling efforts in other countries too. Yesterday, President Joe Biden came out in favor of waiving intellectual property protections for U.S. COVID vaccines, so other countries, including India, can start making those too. And the U.S. has already partially lifted a ban that lets the Biden administration send raw vaccine materials, ventilators, PPE, and other assistance to help India get the virus under control. But will it be enough? I'm joined by Dr. Abraar Karan, a physician at Brigham and Women's Hospital and Harvard Medical School, and a part of the hospital's residency in global health equity. Abraar, good to see you, as always.
Yeah, Adam, thanks so much.
I want to start by asking you if what's happening in India right now is the product of domestic politics or a flawed international system for vaccine development and distribution, or maybe some of both.
Yeah, Adam, I think it is definitely multifactorial, right? So in India, we saw a wave in September. They're registering 90,000 or so cases a day. That was brought under control. In January, much of the world was wondering how India had controlled the epidemic so well. And there was a hypothesis that could it be that 1 in 5 Indians could perhaps have already been exposed to the virus, and could there have been areas that were developing so-called herd immunity thresholds so that cases would continue to come down despite very low vaccination rates. So we saw that that wasn't true. When you start to pull back on non-pharmaceutical interventions like masking and distancing, and you have a setup of a large number of susceptible people in a very dense area or country like India, it's only a matter of time. And the reason that we get caught behind everywhere is that spread is exponential, and there's a delay between when you get infected to when you get sick and end up in a hospital. And so we're seeing this spreading there, but it is definitely a confluence of many different factors. And absolutely, the fact that vaccination and equity has been the way it has been globally, India and many places around the world are very, very susceptible now.
I want to tease out the two pieces of that question a little bit more. I think of, and I do not know much about Indian politics, but I think of Prime Minister Narendra Modi as having some Trumpian tendencies, nationalistic, pugilistic, and also, if I understand correctly, he urged people to gather in large numbers in close settings as this was going in the wrong direction. Is that a fair characterization? Very broad brush, I know.
Yeah, I mean, I'd say broadly speaking, that is what we saw happen. And I do think that the large political rallies and large religious gatherings that were taking place, and the, Modi not wearing a mask in public settings, these things all reminded me, at least, of what we had been dealing with here with former President Trump and the elections here, the rallies, the gatherings, the sort of nationalism, but to a point of detriment. And, it's unfortunate. And now when I talk to people on the ground, because I have a lot of family in India, I've got a lot of people I've worked with, I've worked in the country in rural areas and in cities. And so I have a decent understanding of how public health operates there. And I'm hearing that a lot of NGOs are feeling like the government is not there to support them. A lot of states are dealing with it on their own. So some states have instituted their own lockdowns, whereas there's no federal or national lockdown. And so you do get reminded of what was going on here in the U.S. Largely throughout 2020, where states were trying to do this on their own. And as you know, I worked on the state response in Massachusetts for a lot of last year. And so really it came down to getting things done at a state level and community level.
But then, as you pointed out on Twitter and in other venues, and I learn a ton of what I know or kind of know about these issues from following you on Twitter, there is this question of the way the international framework for making resources for vaccination available works or doesn't work. I had not even realized that the U.S. was standing in the way of greater distribution in India by insisting until very recently on maintaining these intellectual property protections. I should have known that, but I didn't. Can you, for me and for viewers who might not know the way this system works internationally and the way this vital public good flows to certain places and doesn't flow to others, can you offer a sort of a layperson-friendly summary of how it works and how it doesn't?
Yeah, so I mean, generally, you have different pharmaceutical companies, right, that are innovating and trying to get out life-saving vaccines in a pandemic like this. And what happens is, eventually, when a product is made, there are certain patent protections, and there are numerous patents, it's not just one, over different components of a vaccine. And then you have a limited supply that is available initially, and that supply is bought up by the highest bidder. So as you can imagine, wealthy countries and countries that had connections with vaccine manufacturers were able to get their hands on the best vaccines possible. And then you have a slew of other vaccines that are coming out around the world that have different, that go through different regulatory mechanisms to approve them. And there have been some issues with some of those vaccines. And so now, as we come to a point where we know that some of the mRNA technology, for instance, right, like your Moderna and Pfizer vaccines have among the highest in terms of their vaccine efficacy, those vaccines have largely not been approved or not been available or affordable to many, many places around the world. And so the World Health Organization came up with, along with some other groups, COVAX, a mechanism by which there would be large numbers of donations of vaccines that could be earmarked to countries that would not be able to afford and compete for vaccines. And so many of us had been saying that the COVAX mechanism should be scaled up. There should be far more donations to COVAX. This is before the talk about the TRIPS waiver. Now, even with this, with the U.S. saying, okay, we will support a waiver in this setting because of a global emergency, which was just declared this week, many have pointed out that just pulling back on the patent restrictions is not enough, because there are technology transfers. There are very complicated vaccines to manufacture. There are a lot of essential materials. They have to be done just right to get the vaccine that you need. And you don't want to mess up this process, because you can really come out with a product that is not safe. And remember, you're giving this to healthy people. It's different than a medication that you'd be giving to people who are sick. And so generally speaking, there's a long ways to go, even if patent restrictions are pulled back, which I think that, given that nothing was being done and there was a lot of vaccine inequity, this was a step in the right direction. With that being said, there's a lot more work to be done here. So it's not just that, okay, that we're not going to, that we're going to allow for the patent to have broader use. It's also that we need to get vaccines in people's arms. That's a much longer and more complicated process, as we are even seeing in the US as that plays out.
And it seems, as a lot of the more infuriating moments in the pandemic have seemed to be just a tiny step in the right direction. I don't mean to diminish it, a step in the right direction, but coming at a time when the problem is just skyrocketing out of control. And you hear that this step is being taken, and I at least ask myself, okay, that's great, but why wasn't this done, the day that Joe Biden took office, for example?
Yeah, well, prevention has never been popular, right? In public health medicine, prevention, even if you just think to your day-to-day life, prevention is something that's very hard to sell. It's much easier to deal with a problem once it's in your face. It's much harder to deal with it and do something about it earlier on. And the problem with prevention is that if you do prevent something, it's a non-event. You never know if it happened or not. So just like in the US, when we were telling everybody to wear masks and physically distance, if we then did not see a big COVID surge, we would be blamed, saying, oh, well, it never came. Well, it never came probably because we did the things needed to prevent it. And so when we talk about vaccinating the world, I think there's a lot of hesitancy to put our money where our mouth is, or our resources where our mouth is, until something happens, right? So something like India happens, a catastrophic surge, although we'd seen surges in other countries like Iran and other places that don't have great access as well. And so, now we're seeing the neighbors of India, right? So Nepal, Sri Lanka, we're seeing cases really rising in the whole South Asian region, and it's going to spread. And where does it go next? Well, we're all worried it might go to sub-Saharan Africa, where there's very little access to critical care resources, critical care staff. I've worked clinically in sub-Saharan Africa. I remember just 3 years ago, we ran into the same issue. There was no oxygen, or very little oxygen, in a rural hospital that I was working in. So this is not a new problem, but it's certainly going to be a problem. when, not if, these variants start to spread elsewhere.
That picture that you paint, I think, will be enough for most of our viewers to say, if they haven't already said, okay, this is a big problem that the United States and the rest of the world needs to be tackling aggressively. But for people who might not have an altruistic bent, for people who might be inclined to say, oh, that's a shame, I'm certainly glad I'm not in India right now, but it's happening in India and other faraway parts of the world. It's not a problem for us here. How could this become a problem for us here? And I don't mean to sound callous, boiling it down in those terms, but I know that there are connections that some people might not be aware of.
Yeah, absolutely. I mean, there are many reasons. So even though we're vaccinating efficiently here, we're getting, we just are going to be seeing approval of vaccines for teenagers as well. The reality is that the vaccines are excellent, but they're unlikely that immunity is going to last forever. We've also seen breakthrough infections, although they're quite rare. And as the virus spreads more and replicates more, it has more chances for mutation. So when you have large numbers of people getting infected all over the world, you have mutations form, you have advantageous mutations that transmit better, and you've got ones that also can help the virus to evade the immune response as well. And we expect to see that. We expect to need booster shots in the future. But the reality is that until we vaccinate the world and control this globally, these catastrophic surges are going to expedite the issue for everybody else, right? And so a problem elsewhere is a problem here. COVID is a perfect example of this, right? So if we only thought of COVID as affecting Wuhan, well, I think probably a lot of people did initially who don't work in global health. And we saw what the effects of that are. So you do not underestimate the virus at all, especially when it's spreading elsewhere.
All right, Dr. Abraar, Karan, thank you for joining me to talk this through. Good to see you.
Thanks, Adam. Good to see you.